Good evening, everybody, and welcome to this evening's Facebook Live with Breast Cancer Now. My name's Jane. I'm one of the nurses here, and I'm joined by my colleague Sally.
Hi everyone, I'm Sally. I'm one of the nurses at Breast Cancer Now as well.
This evening we're talking about a few sort of kind of different things, but are all linked really. So we're going to be talking about risk of breast cancer. We're going to be talking about sort of some myths that we'll include in that, and information needs and how to navigate what to look for when you're looking for health information, what to sort of perhaps be a little bit more careful of, and we'll talk you through the process for how we produce our health information. So that's our information on our website and all the booklets and leaflets that we produce. We are into the second week of BCAN, Breast Cancer Awareness Month, so you've probably seen a lot in the press, on the telly, in the news about breast cancer and sort of different aspects of living with and beyond primary and secondary breast cancer. So we will talk a little bit about, like I say, risks of breast cancer, but also risks of secondary breast cancer. So this is for those of you or anybody that's watching that's had a primary breast cancer diagnosis. It's to talk about sort of doing whatever you can to also reduce your risks of developing a secondary breast cancer. Obviously, there are some things that are completely out of someone's control, and we don't know why sometimes breast cancer comes back in some women and in some people it doesn't. But we've got information about that just to help people, although it can be a bit sort of scary, just to help you feel sort of forearmed, forewarned, empowered, knowing what to be aware of. Knowing what steps you can take to do the best you can for your health, and what to do if you do have any sort of symptoms or anything of any concern. Sally, was there anything that you wanted to say on the back of that before we sort of get started on?
No, I don't think so. I think you've covered everything well there, Jane.
Okay, so shall I start off with some of the risks, Sally? Would that be the...
Yeah, I guess, through the work that we do at Breast Cancer Now, and, from our own clinical practice before we were working at Breast Cancer Now, we know that certainly during Breast Cancer Awareness Month, or when people are talking about awareness, people kind of want to know other things they can do to kind of reduce their risk of developing breast cancer. And often people who are diagnosed with breast cancer, are sometimes looking for a reason as to why that's happened, and then about kind of factors. So I guess that are two areas. Maybe it's best to start with the first one, Jane, of the risks of related to breast cancer.
So most risks of developing breast cancer are out of your control or out of our control. So the biggest risk factors are being a woman, increasing age. So 80% of people diagnosed with breast cancer are over the age of 50. Or having a significant family history. And significant is the key word here, because lots of people think they have they may well have a family history. They may have a mother or an aunt or a grandmother with who's had a breast cancer diagnosis. It doesn't necessarily mean to say that that will increase their risk. It's whether their family history is significant. And it's when we talk about significance, we look at the number of people diagnosed in a family with breast cancer or breast and ovarian, and the ages those people that were diagnosed. So it's whether there's a pattern, that there's more than what you'd expect to see in a family. So those are your main sort of risk factors. Like I say, and these are things that you can't control, we can't control. But there are some lifestyle risks that we do know that we can control. And some of those are things like alcohol. So we know regularly drinking alcohol increases the risk of breast cancer, and the more you drink, the higher the risk. And sort of being overweight. So if you're overweight or obese after the menopause, that can increase your risk. Being not very physically active, so not following sort of the recommended amounts of physical activity. And by physical activity, we're not talking, about real sort of anything particularly strenuous or arduous, like, running marathons or 5 days a week in the gym. It's about following the healthy government guidelines on physical activity. That includes walking as well. And so these are some of the things, as well as there is now growing evidence that smoking can slightly increase the risk of developing breast cancer. But as we know, sort of physical activity, healthy, being a healthy weight, smoking, and limiting alcohol has a huge range of health benefits, not just breast cancer and not just physical health benefits. We know sort of financial health benefits, mental health benefits, but obviously those really obvious health benefits, physical health benefits as well. We've got a whole range of information on our website about these risk factors and the ways that you can reduce the risk. I suppose there are some other things that we could perhaps talk about, Sally. Do you think in terms of perhaps HRT and the pill, which obviously the balance of the benefits of these things need to be weighed up against the potential benefit, the benefit against the risk?
Yeah, I mean, I think everyone's different, and I think that's really important to think about the our decision making processes and the reasons why we maybe want the contraceptive pill or HRT can be different for everyone. But I think it is really talking about those risks. But what we know is the risks in those kind of areas are low, but you would really need to discuss that with your GP in terms of
Yeah.
what other related risk you might have in terms of taking those medications. And I think that's what we really advocate is those having those discussions with your GP or a healthcare practitioner, so that we're talking about information here, and I think it's key that people get all the information they need to make that kind of balanced decision where you are aware of the risks and the benefits, and for you, what does that mean, and does one outweigh the other? That kind of questioning. I
Yeah,
think we'd say we get asked that a lot, don't we, around
we
HRT or the
do.
pill?
Yeah, and we also get sort of a lot of people that call our helpline at Breast Cancer Now or use our written inquiry service, which we call Ask Our Nurses, that are trying, like you say, Sally, are trying to understand why they've perhaps developed breast cancer, and there isn't you're never going to be able to say to somebody that anything in particular has caused their breast cancer, and it's not about lots of people have the healthiest lifestyle, and they do still develop breast cancer because some of the things, like I say, like age, being female, and a significant family history, are things you can't control, and it's not about sort of trying to sort of apportion any kind of blame or responsibility that something has caused someone's breast cancer, because we could not just say that. And there's lots of people why, lots of reasons why people live the lives they lead. So it's really important for people to try not to sort of have the added burden of feeling guilty if they have breast cancer, because it's enough to deal with.
Yeah, I think that's really important, Jane. And even just people worrying about the risks of cancer as well. We, as you say, everyone's individual. They have things going on in their lives, and I guess it is really around. We know that actually risk associated with breast cancer is really complex. In terms of the research and the evidence, and as you say, not being able to necessarily pinpoint. So for us, it is about trying to break that down for people, and also at Breast Cancer Now, it's important for us to fund research, so we are all the time trying to find out kind of risks and causes, and things like our generation study, which is a long study over a long period of time of multiple years, looking at nearly 100,000 women and following them through that time to really look at some of those kind of factors that might be related. And we've seen kind of some data coming out of that as we go along, looking at all those things that you've just talked about,
Yeah.
those risk factors. And I think just to pick up on your point about family history, it's really interesting, isn't it? Because there, as you say, there is often I would say it's not a myth, but a perception that, someone's breast cancer might be family history related. And as you say, there is a percentage of people where it is related to family history and there is altered genes, but statistically, in the current data, that's around 5 to 10%. So, what we know, 90%, we can't kind of pinpoint or relate it to that. But it's important that people are, if they are concerned, and if their family history changes over time, for example, more relatives maybe being diagnosed, it's important that that thinking isn't just a kind of one-off. And we've got information on our website. As you said, we've got lots of information. We have got a specific leaflet around family history. It talks through that guidance. It talks through what that referral process might be. If you did feel there was any significance there, and you wanted further assessment, your GP could refer you to a family history clinic, and they could do that assessment. Because that, for some people it does result in them being eligible for genetic testing, but for other people it results in them being eligible for kind of earlier screening than the NHS screening programme. So yeah, would say to people, you can call us and we're more than happy to discuss those concerns. There is that information, and then it kind of gives you guidance as to, whether having a chat with your GP and then maybe an onward referral is relevant for you.
Yeah, yeah, absolutely. And I can see we've got some questions coming in. I meant to say, so apologies that I didn't say this earlier. Do post any questions that you have for Sally or I in the chat. We'll get to ones that we can in the live chat in a little while. Hopefully we'll be able to get to some and answer as many of those as possible. If not, we will be posting replies tomorrow morning. But anyone that does have any questions as a result of this Facebook Live, please do call our helpline on 0808 800 6000. We open tomorrow morning from 9, but you're very welcome to leave a message this evening for us, and one of us will give you a call back tomorrow. One of the nurses will give you a call back tomorrow. So yeah, I meant to say that earlier, so I forgot that I mentioned that. So also just going into sort of the diet and lifestyle theme, that does kind of carry on when we're looking about the risk of recurrence, doesn't it? So when we're looking at, for somebody that's had a primary breast cancer and reducing their risk of the cancer coming back. So, we know that cancer can come back either in sort of same or very close to the original area that it was found, or sort of a bit further in more what's called sort of locally advanced or regionally advanced, so in lymph nodes that's sort of further away from the sort of immediate breast and armpit area. And then you can have metastatic breast cancer, where cancer comes back in other parts of the body. And treatment at that point, there's some very effective treatments. The aim of the treatment is to control the cancer and to reduce the risk of it spreading further, to control symptoms, to improve quality of life. But at that stage, it's not what you'd consider a cancer that you would be able to get rid of completely and for it to not come back. And we know that diet and lifestyle can play a role in the risk of, reducing recurrence. So looking at
and interestingly, Julie's there's a question from Julie saying, is it normal to still worry about the breast cancer coming back when you've kind of had the all clear or finished your treatment? And I guess what you're talking about feeds into that.
Yeah. I mean, I think absolutely, Julie, it's very normal to still worry about breast cancer coming back. What we know from our experience on the helpline and in practice, and from all the women that we work with, is that usually becomes much more manageable. That fear and worry becomes much more manageable as time goes on. But what can be really key is getting the right support. So that's about talking to us, talking to your treatment team about, what your risk is, because very often people will overestimate their risk of a recurrence. We have a dedicated service called Moving Forward, which is for those people that have come to the end or they've finished their main hospital treatment, but it's enabling people to move forward with more confidence. We do online events and we do face-to-face events. All that information is on our website, and we can certainly post some links in as well about all of our services. So like I say, Moving Forward is specifically for people like yourself, Julie, who perhaps are in that really perhaps anxious, worried about every ache and pain. That's a very common feeling and fear to have.
Yeah, and I think see some of the focus of this Facebook Live is around information and people seeking information, and I guess that information around, you know, what might you need to be looking out for in terms of signs and symptoms of secondary breast cancer that you talked about when you've had a breast cancer, then of course, you know, that's all embedded in, you know, those underlying fears. And, you know, when do you want that information? How do you want that information? To be able to kind of feel empowered that if, you know, you notice anything, you know, any symptoms, and we've got some great information on our website around, you know, secondary breast cancer, what things to maybe look out for, because what we know is, you know, signs and symptoms can sometimes be other things as well, but it's just important of kind of know, again, same with our kind of breast awareness, it's about after you've had a breast cancer knowing what's kind of normal for you, and then recognizing any other new symptoms, and kind of, you know, in terms of whatever time scale you are when you've finished your treatments, knowing that, do you go back to your team, do you go back to your GP, you know, being armed with that information that, you know, I've had a breast cancer before, I've got these new symptoms, you know, can you talk me through about, do these need investigating, do I, you know, can I come and see you in terms of your team, or can your GP refer you back if it's, you know, a number of years down the line. So we know that kind of follow-up period, there are lots of different models, you know, this kind of open access where people can then get straight back into the system with their teams if they have any kind of symptoms, or other people, you know, if they've been discharged from the hospital after a certain period of time, can go back to their GP. And I think, yeah, for us, it's, you know, through the work we do, we know that, you know, through talking to people with secondary breast cancer, some of them do wish that they'd had perhaps more information. But we also acknowledge, you know, feelings, like Julie might have, of feeling worried about it. You know, will having the information help or not, or how, or what kind of timing, is very individualised to people, and that's our aim, is trying to kind of meet those needs of anyone in terms of that information, and as you say, support as well. Just being able to say, I'm finding this really hard, I'm worrying about it first thing in the morning, last thing at night, and then we know that other people, you know, it's not at their forefront, but as you say, you know, we hear from people that actually later down the line those thoughts maybe become less or different, and actually talking to our Someone Like Me service, where you can be connected to someone else that's had a breast cancer experience and now volunteers to support others. You know, if you feel that matching someone who, you know, found that time, once they finished their hospital-based treatments and that fear of recurrence, sometimes just talking to someone else about it, how they felt, how they dealt with those feelings, some people find really beneficial. And then, as you say, others, that kind of group setting or something like, moving forward is really helpful as well.
Yeah, and often it's, isn't it? We hear from people, and I think what happens is once that main hospital treatment has finished, people I mean, there's lots of different reasons why those, you know, it can be quite a strange time, because often people anticipate the end of treatment, that they're going to be relieved. It's going to be, oh, it's all going to be behind me. It's all
Yeah.
over. And we know that actually in the reality, it's not quite like that. Yes, you know, you've been treated, and to all intents and purposes, you've been treated successfully, but you now have the time and the space to reflect on the trauma that you've been through. Well-meaning friends and family don't also perhaps quite understand, so they might be also sort of using those kind of phrases like, oh, I bet, you know, you're relieved, it's all behind you now, and you can just go back to normal. And often do hear from people that don't want to keep burdening their family and friends with, hang on, this isn't actually, there is, you know, it's a new normal. It's not back to who I was before. Perhaps, you know, it's finding and navigating through a you know, life after, you know, having had a breast cancer diagnosis and being through the treatment. So
Yeah,
there's
and the
lots of
impact of
reasons why it
all
happens.
of those treatments as well. You know, we know last year we had some data around the impact of sex and intimacy, and statistically that was really high in people that we spoke to that had
Yeah.
breast cancer, and you know, that was really impacting their lives, and they, you know, it was about trying to see that as just important as any other kind of impact of a breast cancer diagnosis, and that you can talk to healthcare professionals or organisations like us around, how to manage that impact, or things like, hair loss at the time of your treatment, or things that impact your body image like surgery as well. So I think it's important that that kind of impact of a breast cancer diagnosis is realised, from diagnosis and beyond. And
Yeah.
another area that we hear quite a lot of is managing the menopausal symptoms after breast cancer treatments, as well. That's something we hear a lot about.
Yeah, and a lot of women will be on hormone therapies to reduce the risk of a recurrence for 5, sometimes up to 10 years, and these can have those menopausal side effects that you're talking about, Sally, can't they? So, if you're living, your cancer's been treated, but your quality of life is severely impacted by medication that you're on, then that can be really quite devastating and very difficult to sort of try and move forward with life after, when you're sort of constantly plagued by side effect or symptoms. I mean, obviously not everybody. We know lots of people that take these medications and don't have those kind of problems, but it's everybody is different. It goes back to that, isn't it?
Yeah.
Somebody might have quite a lot of side effects from a hormone therapy, and somebody may not. But what's important is speaking out and getting support, with, like you say, the impact, as well as managing those symptoms and side effects.
Yeah, and I think going back to that kind of information theme or thread through this Facebook, we know that working with other organisations like, menopause and cancer, what they have, some of the insight that they found, as well as the work that we do, is for some people having the information about perhaps what to expect in terms of side effect profile and how they might be managed, before starting any treatments, can be really, really helpful. But again, it's got to go down to individuals' information needs, and how do you get that information, how do you want that information, what's the timing, what's the method, of that information. But again, what people are generally saying is, they wish they maybe knew beforehand, so that they could have maybe been forearmed as to maybe what to expect. But again, as you say, that's that balance, because some people just don't have any side effects, and they're absolutely fine on those treatments, and that's great. They're out there. I suppose it is about, the people that aren't, do get, the information when they need it, and then in turn know who to speak to and the support they can get as well. And we have things, don't we, like speakers live sessions, through our services team, where you can sign up to a kind of a webinar style information, sometimes with an expert speaker. So for example, someone that is expert around managing the menopause after kind of breast cancer, and kind of they can then present their data, and the kind of things that they can do to help. And some people find that information in that group setting from that expert is really helpful.
So, sort of moving on to kind of information gathering, and because obviously we're in sort of a world now of artificial intelligence, and which has some huge benefits. It's especially in the world of medicine, it's that there's going to be some real changes, I think, over the next sort of few years, in terms of what we where we see AI in sort of the world of medicine. But in terms of information, what would you say, Sally, for somebody to make sure they know that what they're reading, what health information they know they're reading, is true and accurate?
Yeah, I mean, as you say, we can only imagine in this kind of changing world that we're living in, that becomes more and more challenging for people. There's an organisation called the Patient Information Forum, who kind of work with organisations such as ours to really assess and help build that trust, in terms of advocating those trusted information, for people to find. And what they found is, for example, 1 in 2 people will have been looking for, this is across the board, will have been looking for health related information in the last week. So, that's statistically really significant of the number of people, and that we know people are looking for those trusted websites. We know that the NHS kind of app and website are really, people get a lot of value from those, but also, organisations such as ours. And I guess it's people being able to find that trusted information, and that may be through your breast care nurse, talking to your breast care nurse about your information needs. How do you want information? We'd say that, in terms of the information we distribute, lots and lots of people affected by breast cancer will have some of our information, and so we're therefore writing that to meet the needs of people. We listen to what people want to know. We have, our expert clinical team at Breast Cancer Now, as well as our editorial team, working really closely together to produce that information that is evidence-based. You can track the evidence via us if you need to, because we know, as I said, everyone's information needs are different. Some people, may want to look at kind of the underpinning research trials, and others may not, and there's no right or wrong in that. But it's about us producing information that kind of meets the needs of lots of people, so that we can hopefully offer information for some of the questions that are coming through about kind of what to expect after your surgery. And that's from the evidence base, but that's also about us going out to experts in practice saying, will this information help you and your patients in practice? It's going to people that have been affected by breast cancer, so what we call lay reviewers, making sure that the way we've written it, the way we say it, is understandable and helpful for people. And so that process is really quite intense in terms of us producing the information people want and need, making sure that is up to date, regularly reviewing that, and involving all of those people that need to be involved to make sure that's as user friendly as possible. And lots of our information may have things like associated video content, or our arm exercise leaflet for your arm exercise after breast cancer surgery. We know that statistically lots of people use that leaflet, and some of them will have the paper form, some of them might download the PDF onto one of their devices at home, so that they can kind of go back to it as well. And then we know kind of video content, some people are real visual learners, they need to see how to do those exercises. So all of that is around us trying to produce this kind of trusted information for people. But I guess it's being able to kind of navigate through those trusted sources, which can be a challenge for people.
Yeah, absolutely. And evidence research doesn't necessarily mean evidence, does it? I mean, we will sometimes hear on the helpline again, or through our Ask Our Nurses service, that somebody might say, "Oh, I've read this paper, I've read this sort of medical paper," and that doesn't mean to say that it's necessarily evidence for something. It's far more complex than that, isn't it?
It is, and again, just looking at questions coming through, about that decision-making process for people's treatments. Is there a higher risk of my cancer coming back? Am I going to be offered, other treatments like radiotherapy? So the information that we produce is around trying to translate that research and those guidelines that the NHS and the private sector kind of work towards, or definitely use, so that people can see who would be the people that are offered. But again, it is really important that you have to view that you are an individual, you're under the care of a team, and we can give you that information to then go arm to your team and say, actually, that joint decision making about what is the right treatment for you as a person, as your medical history, but also the type of breast cancer you have, how it's been treated. We know that those treatment pathways can differ from one person to another, and sometimes that's challenging to kind of navigate your way through that. But that's what people like us and your treatment team are here to do.
Yeah, yeah, absolutely. And the other thing to sort of bear in mind when we're talking about sort of ways people have their information, and just to understand that there are lots of different formats. So like you say, there's the visual, there's the written, we have things in other languages. We have access on our helpline to interpreters. And there's a whole, and also, we use Relay UK. So for people that have speech or hearing impairment or difficulties, then we can certainly, we're available to, everybody and anybody in whatever way it works for them. So it's not to be put off that if your first language isn't English, then we won't have information that we can help provide you with the information and support in a language you want on our helpline. So it's making sure that there's all different ways that we can reach people as well.
Yeah, what we know from research around information is that if people do feel that they've got that trusted information, that they can then feel more empowered to speak to their teams, to kind of question and have that real open dialogue about that joint decision making process. So we know that having that information is really important for people, because for people like us that are working in this area all the time, that information is second nature to us. But when you're in that situation and it's something you've never been through before, and you've got everything added, layered on top of that of your own life, I think it's just, that's what us and other organisations are here for, is to kind of offer that support from that kind of information perspective, specifically of what we're talking about tonight, to give you to make you kind of forearmed when you're going into those conversations, and to know what to expect and to know who to contact if you are concerned, if you've got a pain and that you've just had your surgery, and is that normal. And again, these are really difficult kind of things to necessarily pinpoint on a discussion over the phone, but going back to your treatment team and them knowing you and seeing you, we can help kind of guide you in that direction.
Yeah, absolutely. And we've actually had sort of three similar questions in. So Tracy, Fiona, and Debbie are asking about sort of dietary supplements while they're on tamoxifen or on letrozole and leucoprelin injections. So some vitamins will be safe to take. I mean, what we always say at Breast Cancer Now is, what's the reason behind needing a herb or a supplement? Because if, generally speaking, if you're having a healthy, well balanced diet, then you shouldn't need any additional vitamins. There are some things that some women will be recommended to take by their treatment team. So things like vitamin D or calcium supplements, that might absolutely be recommended, and even and prescribed. But what's difficult is with a lot of herbs and supplements, they haven't been tested in the same way that conventional medicines have. So we don't know as much about what they can or can't interact with. So what we would always suggest is speaking to your GP or your specialist team or a pharmacist about anything that you're considering taking. There's some good resources. So there's a website which is the Memorial Sloan Kettering Cancer Centre, which is actually an American cancer centre, and they have a whole database of herbs and botanicals, and it will have what evidence we do have for that, what potential interactions there may be with other medications, what warnings or adverse reactions people might have with them. So because there are some things that you cannot take, so it's really important to anything that you're checking out, in particular with lion's mane, I don't know, Fiona, I would have to check that one out for you. Certainly with collagen, Tracy, we do know that's something that we are asked a lot about, is collagen supplements, and we do know that there are studies looking at using collagen in women that have had breast cancer, but we don't yet know what the results of that is. Or what that research is. Debbie, I've not heard of Geek Nutrition, so it might be that is perhaps a supplement that's got lots of different things in it. So it would be a question of looking up each item each ingredient in that particular product. But like I would suggest, do always check out with your treatment team, GP, or a pharmacist. Do look at the Memorial Sloan Kettering Cancer Centre for any herbs and botanicals, because there's two different versions of the information. So and you can access either of them. Is that there's a healthcare professional version or there's a lay reader version. Like I say, you can access any of them. One is obviously more detailed than the other, goes into more sort of detailed information than the other, but you can access either or. So I would suggest having a look at those to check out anything that you're thinking of taking, but always get it checked out.
Yeah, I think
I
that's really
would say.
important. But it's we know kind of through our kind of social media feeds and things, lots of things come through, don't they? And it's and of course people are looking for things that maybe make them want possibly make them feel better and things like that. But it is, as you say, it's just really important to get those checked out for all of the reasons you've just said. I was just going back to, I mentioned earlier our kind of arm exercise after breast surgery leaflet, and I know there's Emma's kind of talking that she's 4 months after her surgery, she's been doing all her exercises and then has got a new pain. And I guess what we'll be saying is you probably should, get that checked out, Emma, and certainly don't kind of push yourself and cause yourself more pain until you really know the kind of underlying reason for that. So obviously you've had the surgery and the scarring and kind of any kind of post-operative changes related to that, but it certainly would be worth just ringing your breast care nurse or getting back in contact with your team and just say, this is where I am, and get that checked out.
Yeah, yeah, absolutely. Like you say, not to push through pain.
No.
Sometimes there can be these sort of later effects, where you can get a sort of a new symptom or a later symptom, or side effect. But it's still, 4 months is still relatively early, I would
Yeah.
say. Would you?
Yeah.
Yeah, yeah.
Yeah, and we know in recovery sometimes we take 10 steps forward and then the odd one back now and again, in from that kind of physical effects. But yeah, get it checked out,
Yeah,
because sometimes it's
yeah.
even just things you can do to help with that, and then you can get back to your exercises. So yeah.
Yeah, and sometimes exercises need to be a bit modified for a short period of time, or it might be the
Yeah.
sort of kind of bra that you're wearing can make a difference to sort of how your level of comfort.
Yeah, but and just checking for any other underlying causes as
Yeah,
well. So
absolutely, absolutely, but
and
certainly not unusual.
there are some questions around kind of the risk of people's kind of different types of cancers coming back in here.
Mhm.
On our kind of questions, it's what we'd be saying is maybe having a discussion with your treatment team about the cancer you've had, and the treatment you've had, and how that can reduce the risk of your cancer coming back. But what is your kind of risk, and how you want to have that discussion with them? Would you agree, Jamie?
Yeah, yeah, absolutely. It's very difficult to sort of be sort of so specific about saying, oh, well, the odds or the chances are with this type, because, like you say, it all depends on so many different individual sort of characteristics of the person, the cancer, and obviously your treatment team have access to all your information, all your medical notes, and they know you, so they can sort of say, even, I mean, the idea of treatment for primary breast cancer is to remove it and reduce the risk of it coming back. And for the majority of people, we do know that that's what happens. We also do know that for some people, the cancer does come back, and it might be that they are a lower risk, but their cancer comes back, or they might be a higher risk and their cancer doesn't. So it's very difficult to kind of put a what the chances are, or how often. But for anyone that's asked any of those questions, I would definitely suggest giving our helpline a ring, because we can go through, not necessarily, definitely what your chances are. Well, certainly we wouldn't be able to sort of go through that, but we would be able to explain what things need to be considered, and what can, help you feel more empowered and more in control of your health, and what things to do to look after yourself and get more support, really.
Yeah, and again, it goes back to that kind of information, thread that we've put through this Facebook Live. It's about us helping kind of guide you to the information that maybe talks about things like, radiotherapy, or the risk of your cancer coming back and what happens, in terms of follow-up care and those kind of things. Having that information can help you, feel kind of more empowered, as you say, Jane, and kind of supported in having those conversations. Because as well as all that kind of factual information, it's also about people acknowledging that that is a fear for you, and you need to kind of talk about that fear, and having the facts and the figures, and knowing, what treatment you've had that will impact on those, and that's why those decisions have been made. But also, yeah, just how that leaves you feeling, and how you're going to kind of cope with those feelings, and that kind of living beyond piece that we were talking about earlier, the kind of moving forward. And our Someone Like Me service, talking to someone that's kind of been through that. But yeah, a lot of these kind of questions are related to that decision making process about someone's specific care. And that would be something, as you say, we can certainly discuss with people, the kind of the guidance and the evidence base, but also the feelings, and how to have these conversations with your teams as well.
Yeah, yeah, absolutely. There's probably a couple of questions that we could get to before we think about rounding up for this evening. So, Donna's asking, she's 2 weeks post surgery, not so sure what surgery, but and what scar cream would you recommend? I don't know if I can take that one, Sally, if you want,
Yeah.
or so there's no sort of particular scar cream that we would recommend, providing your wound is healed. And there's no problems. You can use whatever creams suit your body, whatever you would normally use on your skin, and that you like, and it's you don't have any reaction to it. We do have information on our website about, and again we can post something about. It's about sort of scar care. But there's nothing really specifically, Donna, providing your wound has healed, like I say, and there's no issue with wound healing. You can use whatever suits you. If you want to try something new, it's always good to use a sort of a patch test on the skin in the area, just to make sure there isn't any reaction to it. But we wouldn't recommend anything in particular. It's whatever suits, like I say, what you like, what fits your needs, your budget, and whatever your skin likes, really. So, I don't know if you want to add anything else to that, Sally, would you say?
No, I agree with everything you said. I think it's about people, as you say, people have so many different skin types, and I think it is, as you say, I think that kind of, if you are trying something new, that patch test really is important. But the other thing is talking to your team. They may have seen really good outcomes for people using certain things, so they may feel they can suggest maybe a spectrum of things that you could try.
Yeah.
But yeah, it's important that, yeah, you kind of, you're monitoring that scar, which you obviously are, Donna, after your surgery, and maybe, yeah, discuss that with your team as to kind of, yeah, what might be best for you.
And just one of the earlier questions from Jacita, who's actually asking about radiation, and how bad does radiation hurt? So this is sort of radiotherapy treatment, which is often given as part of breast cancer treatment, often after a lumpectomy or a wide local excision. Somebody might have radiotherapy afterwards. You can also have radiotherapy for some types of secondary breast cancer. But I don't know if this is coming up for you, Jacita, if you've got radiotherapy coming up and you're worried about it being painful. But radiotherapy doesn't hurt. Having treatment doesn't hurt. It doesn't. You won't feel anything. What some people can have is sort of skin reactions. They're quite common after radiotherapy, and they can also develop after radiotherapy's finished. So after your course of treatment is finished, the radiotherapy is still working, so skin reactions can still occur, and that might be that depending on your skin colour, on paler skin colours, it might be that it will get pinker or redder. On darker skin tones, that the skin can sort of become sort of purpley, and often that's a temporary reaction. For some people, they might always notice some slight change in the colour or the texture of the tissue in that area, but the actual treatment itself, it won't hurt. Having the treatment won't hurt. But if you've got any worries about treatment, speak to your treatment team. You will have a radiotherapy or an appointment with the radiotherapy team before for your planning. So any questions that you have, you can ask them. By all means, of any worries you've got about any treatment that you're going to have. Anything
Yeah,
else on that one,
no, I would
Sally?
completely agree with that. I think it is, we know that the skin reactions can be on a spectrum, and again, it can be
Yes.
different for everyone. And so, yeah, it's just kind of when you're going through those treatments, knowing who you can talk to during the treatment time, but also afterwards, because we know those effects can come afterwards as well. So, yeah, it's just, feeling armed that you know who to contact if you are concerned. But I agree, it's some people kind of describe it as a little bit like having a kind of X-ray treatment. You're in a radiotherapy machine. You have to be in a certain position. You get positioned. You may have a marking to kind of help to make sure the radiotherapy is going to the kind of correct field of tissue, and then yeah, it's similar to an X-ray treatment, but there's lots of pre-planning in that process. So then there should be the opportunity to kind of discuss those concerns that you might have, and then also what you would do if you do get any skin changes. And certainly from my clinical experience, those teams working in radiotherapy are so proficient and expert in that, and monitoring that. So yeah. And I
Yeah.
think, Lindsay, you just mentioned about a skin rash, and you've had surgery, but also radiotherapy and letrozole treatment. So lots of kind of treatment, lots in your treatment pathway there. And I think if you're concerned about a rash, then it's certainly worth getting that checked out and looking for kind of any potential underlying cause of that. And
Yeah.
get that checked out either with your treatment team or even your own doctor,
Yeah.
maybe who you can get to first. But yeah, certainly worth getting any kind of new rash checked out.
Yeah. Yeah. Absolutely. Um, okay then. Well, I think we've covered quite a lot. Hopefully, it's been informative and helpful. For anybody that we haven't got to reply to this evening, we will be posting replies tomorrow. And we will be carrying on with some more Facebook Live events throughout the rest of Breast Cancer Awareness Month. So do look out for the notifications about the different topics that will be coming up in the coming weeks. And yeah, just thanks ever so much for joining us, and enjoy the rest of your evenings. Thanks a lot.
Bye, everyone.